Welcome then to the home of British general practice, here in the heart of London.
Thanks, the stage is yours.
A safer Africa is a safer UK and indeed a safer world. And this is why Britain has decided to continue funding partnership work through the 50 million ODA Global Health Workforce Programme. And why today I am delighted to announce that we will be expanding the programme further, providing up to £4.45 million in additional ODA funds over the next 2 years. This will prioritise support for at least 2 additional countries. The investment will go towards supporting the development of health workforces through grants with international partnerships with local health systems. The clock is ticking. Action is critical.
Good afternoon, Jim Campbell, the Director of the Health Workforce Team from the World Health Organization, speaking to you from the THET UK Africa Summit here in London. 2 days of engagement with countries across Africa and the UK health partnerships. We've had deliberations on how to strengthen the health and care workforce. What are the needs expressed by African leaders? How do we respond to those challenges? What are the solutions with diaspora movement across the 2 countries? And these are the types of conversations and the partnerships that are essential for peer-to-peer learning.
My name is Moses Mulimira. I'm the co-founder of Uganda Diaspora Health Foundation and also one of the organizers of the UK Africa Health Summit with THET. So for me, it's been about sharing best practices, solutions, and also looking at ways we can improve the world. And UK is leading on that, and the other African countries also are leading. So for me, it's not about the UK telling Africa what to do, but it's about sharing those experiences together and looking at how we can learn from Africa and how Africa can learn from us.
My name is Kristen Smith. I'm the Chief Executive Officer of Insignia Global Partners. It is so important for organisations like Insignia Global Partners to support summits like this, because we need to come together. More than ever, we need to stand as one, share ideas, share our learning experiences, and build relationships with one main objective, and that is to create a better global healthcare for all.
I personally think AMR may be our next pandemic. How do we get them to believe so that the discussions can start? Because if we do not convince them, and I say this is once in a lifetime opportunity, like the high level meeting, we have them ourselves. If we do not convince them, they will simply go back to their countries. The discussions will end on the shelf.
And we make people see this as a One Health issue. After all, we are contaminating the environment through manufacturing effluent and through peeing poo from humans and other animals. How do we make it a food chain issue that is more than 70% of antibiotics going into the food chain? And how do we take that private sector with us on this journey, improving their infection prevention and control, which is called biosecurity? And then there's the human elements. So they're all entwined. It's One Health, and we have to do more.
I think big theme of the summit has been we're in this together. It's a statement of the obvious, isn't it, when you think about the 1 in 5 NHS staff who report a non-British nationality. Many of them are from African countries. So we're joined at the hip in terms of people and in terms of institutions. We're also joined at the hip, of course, in terms of pandemics and common challenges that we face. For example, the challenge of antimicrobial stewardship, which is a big theme at this conference, given the high-level meeting that's happening later this year. So it's not so much about, why is it important to collaborate more between the UK and Africa? It's the inevitability of that. The facts on the ground speak to the necessity of that collaboration and the reality of that collaboration.
It's been an absolute delight to be at the UK Africa Health Summit with partners from other government departments, arm's length bodies, national stakeholders, and of course all our friends and colleagues from across Africa. For me, the real value of this has been to discuss migration. We've had some really open conversations, and this forum has really enabled that. So really grateful to colleagues from THET and WHO who have enabled those discussions, or to continuing those. And again, thank you to THET for organising this.